are against physician-assisted suicide. We find that it's morally wrong and should not be put on a physician's conscience to give a patient lethal drugs. There are many doctors against doing it. It can lead to PTSD in some severe cases with physicians and nurses. It goes against the doctor's Hippocratic oath. It creates a slippery slope at which assisted suicide might become the norm for people with terminal illness. Instead of taking the time to treat and cure the illness, it violates the International Code of Medical Ethics. It eliminates the need for palliative care and takes away jobs for those in the palliative care program. And PAS is taking a life away prematurely. It's not fair for the victim's physician or their friends and family in having to deal with their deaths.
All right. So doctor-assisted death refers to a practice in which a physician provides a competent, terminally ill patient with a lethal dose of medication at the patient's request. How can assisting in one's death ever be right? Well, I guess that depends on one's personal convictions on what is and is not right. Is it right to allow someone to live in a constant state of suffering, pain, and the unknown? Is it right to not give an individual facing terminal illness the option to choose to end their own lives? As patients, we have a lot of rights in this country. We have the right to reduce or simply refuse treatments such as chemotherapy and operations. We have the right to end a life of someone who's on life support. And we have the right to issue a do not resuscitate order. And guess what? We have the right to terminate the lives of unborn children. So with all these rights that are medically afforded to us, how can it not be right to have someone be able to end their own life with the help of their doctor? It is a basic human right to live without pain and suffering, so it should also be a basic human right to die with dignity and free will when faced with little to no chance of brevity.
Back to you guys for your 4 points when you're ready.
All right, point one. So palliative care is a type of healthcare for patients and families facing life-threatening illnesses. Palliative care helps patients to achieve the best possible quality of life right up until the end of life. Palliative care is also called end-of-life or comfort care. It relieves the pain so patients are not reluctant to choose euthanasia and allows patients to live the rest of their lives in ease. Paul Dunn, who has worked with over 1,000 dying patients in Hobart, has said that only 5 patients that have ever said, "Kill me." It takes away resources from palliative care if assisted suicide is put into effect. And in palliative care, there has been cases where patients have been persuaded against physical assisted suicide and fought off their cancer and survived.
Legalizing doctor-assisted suicide may cause unwanted changes in our healthcare system and society. A dangerous precedent is going to be set. Attitudes will slowly change until it includes non-voluntary and involuntary patients. Very ill people or those with severe disabilities may feel pressured to request doctor-assisted suicide to not be a burden to others. Legalizing doctor-assisted suicide may dissuade research into curing terminal illness because there's always an easier option. Doctors are human and make mistakes. Someone may choose doctor-assisted suicide when nothing's wrong. What's to prevent the assisted suicide become the treatment of choice?
And it's against the Hippocratic oath. It clearly states in it, "I will neither give a deadly drug to anybody who asks for it, nor will I make a suggestion to this effect." So what's the point of taking an oath if there's laws against one of the main points of said oath? The Hippocratic oath is the foundation of medicine, and it's a malpractice medicine to give lethal drugs to patients, and a large number of doctors are against breaking their oath.
Legalizing euthanasia would violate the International Code of Medical Ethics, which states, "A physician shall always bear in mind the obligation to respect human life." Doing this would also hurt the doctor-patient relationship in 2 different ways. Hastening death on a regular basis could become a routine administrative task for doctors, leading to a lack of compassion when dealing with elderly, disabled, or terminally ill people. People with complex health needs or severe disabilities could become distrustful of their doctor's efforts and intentions. They may think that their doctor would rather just kill them off than take responsibility for a complex and demanding case. Also, it's legally considered murder, and the person giving it will also be affected. And then that's it. Okay. Thank you.
All right. So, we'd like to start with our first point, which interestingly enough is also the Hippocratic Oath. Many opposers to this often, as you did, turn to the Hippocratic Oath, which is, again, the thing that doctors swear and live up to in their medical careers. They use the phrase that they will not give a deadly drug to those who ask for it, nor will I make suggestions to the fact as the guiding light. However, as modern medicine has evolved, they've amended this oath many times. There was references to women practicing medicine that were removed. There was things about the skin not being broken by doctors. Those were also removed because, as you know, we perform surgeries on a day-to-day basis. And let's just not forget that the oath still to this day states that I will not give an abortive remedy to a woman who requests it. However, according to Statistics Canada, we still performed 81,897,000 of those last year. So, also, when animal companions become very sick and have no hope of recovery, we generally see it as the compassionate way to provide them with a timely, peaceful death by providing them with euthanasia. So putting animals down is something that is totally universally supported. Even PETA, who is an animal organization for the protection of animals, in 2012 released a statement saying that when euthanasia is performed properly, it is the most compassionate option to prevent suffering. Also, American author Beverly Rycroft said, "This is what I find so strange. We are not necessarily kind to animals. We use them, we eat them, but we don't like them to suffer. Yet humans must. They have to wait for the great vet himself to decide how long and deep their anguish must reach, and as far as I can see, he has a habit of waiting a long time." Animal euthanasia is often referred to as the compassionate end, so why is doctor-assisted death not considered the compassionate way for humans as well?
People living with terminal diseases and illnesses tend to turn to doctor-assisted death to ease their suffering. An estimated third of people living with HIV or AIDS have considered asking for doctor-assisted death. Brittany Maynard, a 29-year-old woman, had brain cancer. She was a strong advocate for death with dignity, and she was famously quoted for saying, "I do not want to die, but I am dying, and I want to die on my own terms." She actually her and her family moved to Oregon in pursuit of doctor-assisted death. She was given a lethal dose of drugs and passed away on November 1st, 2014. Our second point is the financial implications for doctor-assisted suicide not paid for is very substantial. Of course, now that it's legal in Canada, that doesn't so much pertain to us. It is still $250 in BC to perform the process, and Alberta is bringing up some regulations to do that. Before it was legalized, Kathleen Carter, she was 89 years old and she suffered from spinal stenosis, which quote unquote left her stiff as a board. That was right from her. Her daughter and her in 2010 went to Switzerland to end her life, and that was about $20,000 to $30,000. This included flight, hotel, and the actual process, so obviously that is a substantial amount. Susan Griffiths, 72, suffered from multiple system atrophy, which is a lot like Parkinson's. She traveled to the Dignitas Clinic in Zurich in 2013 for the process. The Swiss doctor said DADs, which is doctor-assisted deaths, doubled between 2008 and 2012, when 611 foreign people traveled to Switzerland to die. So obviously, for 20 to 30,000 people, or $20 to $30,000 for one of those people, that's quite a lot of money. That's it.
4 points?
Yep.
Great, thank you. Okay, so now you have a minute break.
We'd like to start. You mentioned the palliative care system in Canada. We just have a couple of stats that we think you might want to know while you're talking about palliative care. The Near North Palliative Care Network says that in Canada, on average, it costs the government $36,000 for one individual to die in a chronic care facility or a hospice based on a 6-month stay. If they decide to die at home, that's $16,000 in 6 months that the government shells out. And if they have to spend a day in the hospital, that's $1,000 a day. And the production of the drugs used in this system, according to this same study, is $35. So we could be saving a lot of money. And not to say that the hospice care isn't still there for the people who want it, but when you're talking 1 out of 5 people that desires those, why can't we save that money?
Go ahead. Just keep on going back to that.
So the big thing that you mentioned was in all of your examples for someone who wanted doctor-assisted suicide, you only mentioned those with cancer and other forms where they still have the presence of mind. What I'm talking about is patients with dementia or Alzheimer's, something that affects their mind and is going to hurt. They're not going to know what's going to happen around them, so so maybe their family members who, God forbid, would be sick of dealing with them can just have an easy way out when dealing with them.
In the Netherlands in 2014, 81 people diagnosed with dementia asked for doctor-assisted death.
Before they were too far gone. So there's lots of safeguards in place that say you have to be mentally competent, you have to go through 2 doctors. There's lots of things putting the brakes on people just being able to, oh, I have dementia, okay, I'm out. Like, there's safeguards in place specifically to protect those people.
But what if later down the road, they sign this document that says, if my dementia gets so far gone, I want to go.
Mhm.
What if later down the road, they say, like them themselves, say they don't want to do it? Who do you trust? How do you know?
I think that's where the importance of living wills come in, and that's not what we're here debating. And also you used what if, and are we here debating what ifs, or are we here debating facts? You also, you also brought up the fact that doctor-assisted death is murder, but I'd just like to refer back to the definitions of both suicide and murder. Suicide is the act or instance of taking one's own life voluntarily and intentionally, especially by a person of sound mind. Okay, not debating that, but you mentioned that it's murder. Well, Webster's defines murder as the crime of unlawfully killing another person with the thought of malice. And I don't know about you, but I don't know many doctors that are going into the idea of doctor-assisted death with malice in mind.
And to add on to your point about costing money and palliative care, are you going to really put a price on a human person, a human life? It affects many people.
Well, you also talked about morals in your speech, and we just actually wanted to bring up the fact that not granting these people their doctor-assisted death is actually, I guess you could view it as morally wrong as well. Cindy Cowan, who is a Toronto-based veteran, who is a very big activist for doctor-assisted death, passed away in 2013 from ovarian cancer, and before she died, she was quoted as saying, "I'm not frightened of death, I'm frightened of the kind of life that I might have to live until I die." It's hard to claim morals as a reason for something because morally everybody differs. You can't use morals as like a fact. Morals is what each person believes.
We're losing this, so I'm going to drop a bomb. The Nazis did it. Do we want to be like the Nazis? No.
They also had a lot of scientific advances that we still use to this day. So
Compare dogs and vets using euthanasia to put their animals down, to put them in ease. We can't really understand animals, so we don't know if the
right,
animals
so they
want
can't
to.
ask for it, but a human can.
Yeah, but why is the share that Vegas gets put down?
Couldn't that be used on the opposite way though? We put a dog down, they never ask for it, but the people that are alive and asking for it and of competent mind are asking for it, and we're not granting them that anyway. Also, just lastly, it doesn't matter what happens from here. People are going to do it anyway. The American Suicide Association found that 20% of suicides in America were the result of terminal illness diagnosis being given out. So this caused more pain and suffering on their families as they weren't given the opportunity of counseling, planning, and they weren't given the opportunity to kind of say those goodbyes that doctor-assisted death gives. They just took their lives anyway, so people are going to do it regardless.
Okay, thank you, Summer. Okay, so 1 minute to prep.
Suicide can ease a lot of pain, but at what cost? What are we willing to risk in order to ease the pain of someone? The relationships between doctors and patients, the permanent change in our attitudes. Moving forward, we shouldn't burden doctors and nurses with the responsibility of murdering people. That's all I've done.
Physician-assisted death, when it's boiled down, isn't about how we as individuals feel. It is the fact that we as individuals have the right to freedom, thought, beliefs, opinions, and dignity. Until it comes to death, when face to face with death, we have our freedom stripped, our beliefs questioned, and our opinions disregarded, and our dignity discarded. Not supporting one's right to choose to die in a means that is humane and of their choosing is to tell them that they deserve to feel pain, suffering, and a slow loss of everything in which makes them feel alive. So we asked you at the beginning, is it ever right to assist in one's death? I'd like to ask you something again. If it were you, would you not want to know, would you not want the decision to end your life on your own terms?